Monica writes in, good to see Dr. J. Question, why does my stool float? Great question, Monica. It's because you're not digesting your fat well. So the question becomes why, typically issues with the gallbladder and or digestion. Now, could that be from an infection? Could that be from not enough stomach acid and enzymes to then activate CCK, which is the hormone that triggers the gallbladder to release bile? It could be all those things. It could be you eating a whole bunch of low fat for a while, and then you got a whole bunch of gallstones or crystallization in the gallbladder, and now the bile is not flowing well. But you're definitely not digesting fat for sure. And that's not good because fat-soluble vitamins A, D, E, and K, and EPA, and DHE, and all these good saturated fats are really important building blocks for our cell membrane. They keep us satiated. Ideally, if we're going to be more of a fat burner throughout the day by keeping sugar and carbs lower, we're going to be needing to burn off a lot of that fat. So we want to make sure we can digest it and break it down. So bile salts, HCl, enzymes, and you got to get to the root cause. And that could be an infection. It could be some other hormonal things too. What are your thoughts on keto urine strips? Again, where's my meter? I use the Precision Extra for measuring ketones. I use blood. So when you start getting into ketosis, what happens is you're very inefficient at using ketones. So you're peeing a lot of the ketones out. You're not using it for fuel. Now, as you get more efficient at it, you're going to start burning and utilizing more of those ketones for fuel. So you'll be peeing less out in the urine. So what'll happen is you'll have this, feeling that, hey, I'm not in ketosis as much. Something is going on. I'm seeing, the color is like closer to 5 on the keto stick, whatever you're using, and you'll think that you're not doing it right. So that's why it's beneficial to see what's in the bloodstream via the blood, because you get a better indication of what's in the bloodstream versus what's in the urine, because the urine is basically what's not being burned and what's being excreted. So you can have a lot of it being burned efficiently, not a lot going in the urine, and you may think you're not in ketosis. So hope that helps. Mike writes in, other than probiotics, what can I give my 1-year-old that is teething and recently took antibiotics? Oh, awesome question. I'm dealing with that with my kid now. So number one, with teething, there's a awesome homeopathic called Camilla, and we've used that and it absolutely kicks butt. It works awesome. Be careful with like Oragel or like benzocaine or these type of things. There's a couple of anecdotal case studies of babies having decreased oxygen and having to go to the ER, right? They stop breathing. It affects the muscles in the lungs or wherever it's affecting. It's affecting the lungs or the breathing muscles because they stop breathing. So I recommend the Camilla homeopathic. Works phenomenal. And then regarding probiotics, we typically give the Infantis strain. That's really good. Give the Infantis strain. And then outside of that, that should be a really good help right there for sure. And then you could also give some curcumin to your wife as well. Curcumin or turmeric, and then some of that could be passed down into the breast milk. Curcumin is a really good galactagogue, so it'll increase breast milk production, and the baby will get some of that. And of course, just making sure your wife's really, breastfeeding and having really good anti-inflammatory diet that's nutrient dense, so those nutrients are going down to your baby. Let's see here. Amy writes in, how much is a good dose of fish oil? How much is a good dose of oil of oregano to help with overall skin health to get rid of dry skin? Well, it depends. I mean, if you're talking dry skin, there could be some fat malabsorption. There could be some bad digestion of the fats and the proteins. So I'd make sure you're actually digesting fats and proteins well. And if you're talking about oil of oregano, I think you're maybe assuming there could be a yeast issue or some kind of a bacterial issue. So in my line, like we use the GI Clear 5, which is an emulsified oil of oregano that's enteric coated. And we do 2 capsules 3 times a day. So 6 caps total. That's the GI Clear 5. But I'd want to make sure that you're actually able to break down fats and proteins well, and that's not the cause of your dry skin, because that could be it too.